Hi everybody, Vijay from 21D here. Today we're going to talk about something that we have in our process right at the beginning of the process. So we get between 100 and 150 inquiries every single day from all over the country. And it's a mixture of people sending us inquiries from Google, our website, Facebook, their dentist, they've been referred by a friend. And the process begins by you guys sharing some baseline photos with us. These photos really help you in the early stages, A, by understanding what we think your clinical need actually is, and B, getting an idea as to whether our solution is the right one for you. So our coordinators will ask you for these photos, and we communicate primarily through WhatsApp, and we find it's a great medium because we can share all kinds of stuff with our patients. We can educate them on how the process works by sharing multimedia files, videos, all kinds of stuff, because we understand it's a steep learning curve for patients. And what we find in our experience is the more educated the patient is about oral rehabilitation with implants and living with a fixed prosthetic state with implants, they make better choices. So really the objective that we have is to just help you understand, first and foremost, whether our solution is the right one for you. So I'm just going to run through some photographs and show you ones that fit criteria based on the requests that patients have and don't fit criteria. And we're just today talking from the dental perspective, from what's going on in the mouth itself. There are other things, there are other measurements that we have. We'll talk about them in another video. So we will talk about, for example, medical profiling. So you might need it at a dental level, but surgically, it might not be right to treat you if, for example, you have uncontrolled diabetes or you're smoking 60 cigarettes a day. It would be wrong of us to take you down the road to do surgery because we just know that the healing parameters won't be anywhere near good enough to give us a predictable long-term outcome. So we shouldn't do it until we work on the things that are wrong first. And it's not just our rules. In all areas of medicine, it's very important that a patient is medically suitable for surgery. So it's not just filling in some gaps with some screws. There's a lot more to it than that. And then the other tier that we look at very carefully is psychological profiling. We're going to talk about that in a separate video. And psychological profiling is, are you mentally ready to make the journey? Are you emotionally ready to transition from having body parts, your own body parts, to being in a prosthesis? In our experience, about 20% of patients are not ready at the time that they actually engage with us. They just think it's put some screws in, screw some teeth on, that's the end of it. We don't make teeth, we make prosthetics. And that distinction is really important, and they're just not ready to make the journey. And they shouldn't make the journey until they're more educated and more understanding and do more homework and speak to other patients about the reality of living with oral prosthetics on implants. They are not the same as teeth.